Welcome back. These uncertain times are especially scary for kids who don't understand social distancing or why everybody is so worried. So joining me now is Dr. Lori Stevic-Rust, clinical health psychologist. You know, kids don't question when there's a snow day and they don't have to go to school, but this is kind of different. And a lot of them are questioning, why can't I go to school? So what's your advice to parents?
Yeah, I've heard a lot of parents say this is, you know, normally, as you say, kids are really excited, like there's a snow day and I get to be home and this is kind of fun. I think, again, they're getting the sense and they're reading the anxiety. And so the question now becomes, well, what do you mean we're never going back to school, and how long will it be, depending on the age of the child? So I think for parents to kind of mitigate some of that anxiety for their children is to remember a couple of things. First, to ask questions of their child, because kids make up stories, they hear bits and pieces, and then they tell themselves a story. And so you want to be able to ask them questions to understand, engage, how much do you understand about this? And then we can correct those false misperceptions. And then the other thing is about routine and habit. Just because there's no school doesn't mean it's a free-for-all all day long. I know there are parents who've really put together very structured schedules so that, you know, there's still playtime and free time, but being at home is now about still studying, still having a break, and then also talking about hygiene, which is, you know, even after this is long gone, if nothing else happens, we have the opportunity to teach our children about good hand washing, why germs are important, to make sure that we're paying attention to germs, how germs can spread. So again, I think there are a lot of messages that we can share with children to use this opportunity as teaching moments. But remembering that, again, they're going to take the lead from us. If we're anxious and we're frightened and we're talking about, oh my God, and what's happening next, children's anxiety, their sleep's going to become disrupted. So we really need to make sure that we're setting the right kind of a tone in the house.
Perfect advice. Yeah. All right, Lori, thank you so much. Meanwhile, I'm going to answer 3 common questions you've been sending us. First, you've been asking, what are the symptoms of coronavirus? Well, symptoms may appear 2 to 14 days after exposure, and according to the CDC, typically include fever, dry cough, and shortness of breath. Now, if you developed difficulty breathing, you need immediate medical care. Next, you wanted to know, when do I need to go to the doctor? Well, if you suspect you have the virus, don't go to your doctor. You need to call ahead. It's still cold and flu season. Now even allergies are popping up. Use telemedicine if you have it, so you can have a virtual visit, or your doctor will decide if you need to be tested. But flu has to be ruled out first before you get the COVID-19 test. And finally, what do I do if somebody gets it in my house? The CDC says the patient needs to be quarantined. So does everybody else in the house who may have been exposed. No visitors allowed. They can leave food at the door. If possible, separate the infected person from everybody else with their own ventilated bedroom and bathroom. If it's possible, they should have minimal movement in the house. If that's not possible, they need to keep at least a yard away from everybody else and share nothing. Russ, back to you.
All right, Monica, great advice as always. I'll see you back in here in just a moment.
Sure.